Welcome to the deep dive. We get straight into things you want to know.
That's the plan.
Okay, today, dog behaviors. Specifically, marking, roaming, and mounting. Things that can be, well, a bit baffling sometimes.
Right. And you want quick, solid answers, not hours wading through research.
Exactly. These are, they're normal dog things, right?
Yeah.
But they can definitely become frustrating for owners.
Absolutely. They're fundamental behaviors, sure, but context and frequency matter. We've looked at expert sources like Managing Common Dog Behaviors to really unpack this for you.
So our mission today is to get a handle on the basics, the causes, and importantly, the solutions for these behaviors. You're fast track, hopefully.
Let's dive in.
Okay, let's start with definitions. What exactly is marking in the dog world?
Well, marking is basically communication. Dogs use scent urine, sometimes feces, secretions from anal sacs or other glands to leave messages.
Messages, like what?
Messages for other dogs. It could be about territory, defining their space, or just signaling their presence. Think of it as a biological status update.
Okay, a status update. Got it. And roaming.
Roaming is pretty much what it sounds like, a dog just wandering off, exploring.
Why do they do that?
It could be curiosity, searching for food, looking for social contact, or, if they're intact, seeking a mate.
Mm-hmm.
It's an instinctual drive.
Right, that call of the wild thing.
Okay.
Okay, and mounting. This one can make owners a bit uncomfortable sometimes.
Yeah, it can. Primarily, it's linked to mating behavior, obviously. But you also see it a lot in social play, especially with younger dogs.
So it's not always romantic.
Definitely not. Context is key. Could be hormones, could be play, could even be attention-seeking, believe it or not. Same action, very different reasons sometimes.
Huh. Okay, so these are all normal dog behaviors. When do we cross the line into this is actually a problem?
Good question. It becomes problematic when it's excessive, happening all the time,
Hmm.
or when it occurs inappropriately, like marking inside the house.
Right.
And it's also a flag if you see these behaviors strongly in dogs that have been spayed or neutered, where you'd expect the hormonal drive to be much lower.
Makes sense. How common are these? Do certain breeds do it more?
It's hard to get exact numbers, honestly, but pretty much any breed can exhibit these behaviors.
And when do they usually start?
Often around sexual maturity, maybe about a year old, give or take. But mounting, like I said, you can see that even in young puppies during play.
And it's mostly intact dogs.
Mostly, yes. Intact males and females in heat are definitely the most common culprits for hormonally driven versions. But neutered and spayed dogs absolutely can and do show these behaviors too.
Okay, so what are the specific signs we should look out for? What does marking look like besides the obvious?
Well, for marking, it's finding urine spots, often small amounts in places you wouldn't expect. Usually vertical surfaces, inside or outside, sometimes feces too. Interestingly, female dogs don't often mark inside the house.
Good to know. And roaming. That seems straightforward.
It is. The dog leaves home, goes wandering. Pretty clear sign.
And mounting. How do we recognize that specifically?
It's when a dog raises its front end onto another dog, or sometimes a person, or even an object like a pillow. They might wrap their front legs around and often make those pelvic twisting movements.
Okay, yeah, not subtle. Could there be a medical issue behind any of this? Should we check their health?
Usually a standard vet check is normal. But yes, especially with marking, you'd want to rule out medical causes like a UTI or something.
And what if your dog is the one getting mounted inappropriately?
Yeah, it's actually a good idea to get the dog being mounted checked out too, just in case there's something attracting that behavior.
Okay, right. So we know the what. Let's dig into the why. What's driving these behaviors?
First thing to remember, these are normal, natural behaviors for dogs. They have roots in instinct and communication. Lots of potential causes.
Like what?
Well, take urine marking. It's super common when a dog enters a new place, like a new home, or even just visiting somewhere.
Is that just territory claiming?
Partly, but it's also about self-assurance. Like leaving a familiar scent makes them feel a bit less anxious in strange surroundings. It's
Nice.
saying, I am here.
Interesting. And hormones, we mentioned those.
Oh, definitely. Hormones are a big driver, especially in intact males. They're just more predisposed to roaming, marking, and mounting because of testosterone.
But it's not only hormones.
Yeah, absolutely not. Learned behavior plays a role. Personality, anxiety levels. It's complex. Reproductive status isn't the whole story.
Okay, let's break it down then. Roaming, what are the specific triggers?
Could be anxiety, like separation anxiety. Could be boredom, just needing more stimulation. Curiosity is a big one. Seeking mates, as we said. Social contact, play. Often it's a mix.
And marking. You said communication, but not just needing the toilet, right?
Exactly. It's information exchange, telling other dogs about social rank, sexual status, territory boundaries, even just general info. Fido is here. It can also be anxiety-related or rarely linked to medical issues causing more frequent urination.
Got it. And mounting. Beyond the obvious mating drive.
Right, so besides actual sexual behavior courtship, even masturbation mounting is common in play. It can be about social status, trying to assert dominance sometimes.
Anything else?
Yes, attention seeking is a big one people sometimes miss.
Yeah.
Does the dog only do it when you're right there, maybe trying to watch TV?
Yeah, I could see that.
They learn quickly what gets a reaction. It can also stem from anxiety or, in some cases, become almost like a compulsive habit.
Wow, okay. That really shows how layered it can be. Are there specific risk factors, things that make a dog more likely to do these?
Well, we keep coming back to it, but being an intact male is definitely the biggest risk factor for all three, mainly due to hormones.
Okay.
Then there's learned marking. The dog that has to mark every single lamppost on a walk. That can become ingrained.
Right.
And as I mentioned, mounting that only happens when the owner is watching, often points towards attention seeking.
What about females?
Intact females, obviously, especially around their heat cycles. And some studies suggest females spayed after their first heat might be slightly more prone to some marking than those spayed earlier, though it's not a huge effect.
So it's complicated. What if it's not just typical behavior? When do we need to think, hang on, could this be something else entirely?
That's the differential diagnosis part, yeah. Crucial to distinguish normal, albeit inconvenient, behavior from a sign of an underlying medical or more serious behavioral issue.
So for roaming, what else could be going on?
Besides the usual suspects like sexual drive or curiosity, well, think about separation anxiety, noise phobias causing them to bolt, maybe extreme hunger driving them to forage, even things like chasing prey, social facilitation just following other dogs, or very rarely, a testosterone-producing tumor in a neutered dog.
That's quite a list. And for marking. Right.
Again, beyond normal communication,
Hmm.
maybe a tumor, serious territorial disputes, social conflict causing anxiety, maybe house training just wasn't fully established or they've relapsed. And definitely rule out medical, UTIs, kidney disease, diabetes, anything increasing urination. Even gut issues like constipation or diarrhea or anal sac problems can sometimes trigger marking.
Okay. And mounting. Other possibilities.
Similar themes, strong sexual drive, possible tumors, social status issues. Also consider other medical things like endocrine diseases or urinary tract issues that might cause discomfort leading to mounting.
And you mentioned the dog being mounted.
Right. If your dog is constantly being mounted by others, it's worth checking them for things like estrogen-producing tumors or infections, anal sacs, uterus, vagina, urinary tract that might make them unusually attractive to other dogs.
Good point. So if we suspect something more is up, what tests might a vet run?
Well, if the physical exam shows anything unusual, they'll likely start with the basics. Blood work, like a CBC and chemistry panel, and a urinalysis, just to check general health and rule out common medical causes.
And beyond the basics.
Depends on the clues. Maybe thyroid tests if hunger seems linked to roaming. Potentially checking testosterone levels, even in a neuter dog if they're acting like an intact male. Urine culture if infection is suspected. Vaginal cytology to check a female's heat cycle status.
And for the dog being mounted?
Similar things possibly. Blood estrogen levels, urine culture, vaginal cytology and culture if discharge or irritation is seen.
Would they use x-rays or ultrasound?
Yes, if they suspect something internal, like a tumor or other abnormality causing the behavior or attracting mounting. Imaging can be really helpful then. Other specific tests would depend entirely on what they suspect medically.
Okay, this is great info. We've covered the what, who, why. Now the really practical part. What can we do about these behaviors if they're causing problems?
Right, treatment. It really hinges on figuring out that why. And owner education is absolutely number one. You have to understand what's going on.
Let's start with roaming. What's the advice there?
Prevention is key. Secure fences, gates latched. Always use a leash on walks, no exceptions. Make sure the dog gets enough exercise, physical and mental, plenty of positive attention, supervision.
What about stimulation?
Hugely important.
Yeah.
Puzzle toys, training sessions, maybe even doggy daycare for social dogs can help burn off that energy and curiosity in a safe way.
Okay. Now, indoor marking. That's a big headache for people.
It really is. Management is crucial. Restrict access to areas they've marked before. Supervise closely when they're loose indoors. Use a crate or confined space, if they tolerate it well, when you can't watch them directly.
What else?
Try to identify and remove triggers if possible. If anal sacs seem full or impacted, get those expressed by a vet or groomer. Belly bands for males or special doggy pants for females can be helpful management tools, especially short-term.
And cleaning is important, right?
Absolutely critical. You must use an enzymatic cleaner designed for pet stains. Regular cleaners won't break down the urine molecules, so the dog can still smell it, which invites remarking.
Good tip. What about training?
Consistent command-reward interaction is key. Reinforce good potty habits. Sometimes counter-conditioning or desensitization to specific triggers might be needed. Very occasionally, with professional guidance, remote punishment like a water spray bottle or an alarm might be considered, but carefully.
And mounting. What's the approach there?
A lot of similarities. Solid obedience training, using commands and rewards. Again, counter-conditioning or desensitization if there are specific triggers or anxiety. Ensure they have enough exercise, mental outlets, and attention.
What if it's for attention?
If you're pretty sure it's attention-seeking, then actively ignoring the behavior, no eye contact, no talking, just get up and walk away, can sometimes extinguish it. And again, remote punishment is a last resort, used cautiously.
We talked about hormones. What about spaying and neutering? How much does that help?
It can help significantly, especially if the behavior is strongly hormonally driven. Neutering males often reduces marking, roaming, and mounting. Spaying females eliminates heat cycles and associated behaviors.
Is earlier better for females?
For marking, there's some suggestion that spaying before the first heat might be more effective in preventing the behavior from developing compared to spaying later.
Okay. Are there medications used for these things?
Generally, medication isn't the first stop for roaming, unless there's a clear underlying anxiety issue, like severe separation anxiety or a phobia. Then you treat the anxiety. Any medical causes found obviously need direct treatment.
What about for marking or mounting?
There aren't actually any drugs specifically approved for marking or mounting in dogs. So if a vet considers medication, it's usually because they strongly suspect anxiety is a major piece of the puzzle. It requires informed consent from the owner.
So it's off-label use.
Essentially, yes. And it should always be combined with a behavior modification plan. It's not a magic pill. A vet might discuss options like certain antidepressants or anti-anxiety meds used in veterinary behavior, explaining the potential benefits and side effects.
It sounds like medication is really something to discuss carefully with your vet then.
Absolutely. It's a complex potential side effects interactions, requires careful consideration and monitoring.
Which brings us to follow-up. How do we know if any of this is working?
Follow-up is crucial. You need to monitor the behavior closely. Keeping a log or journal when, where, what happened just before is really helpful.
Why?
It helps you and your vet see patterns, track progress, and decide if the treatment plan needs adjusting. If medication is involved, regular check-ins are essential. For marking, constant vigilance indoors and daily checks for new spots are recommended.
Can we do anything to prevent these issues from starting?
Well, responsible ownership helps a lot. Neutering and spaying, as we discussed, significantly lowers the risk of hormonally driven behaviors. Providing proper training, socialization, exercise, and mental stimulation from a young age sets a good foundation.
What happens if these behaviors just aren't addressed? What are the risks?
The risks are quite real. For roaming dogs, getting lost is obvious, but also being hit by cars, getting into fights with other animals, or ending up in a shelter via animal control.
That's serious.
It is. For marking inside, it can cause significant property damage, hygiene problems, and strain the human-animal bond.
And mounting.
Excessive or inappropriate mounting can damage relationships with other dogs, leading to fights and potential injuries. And sadly, when these behaviors become unmanageable for owners, it puts the dog at risk of being relinquished to a shelter or rescue. That's the unfortunate reality sometimes.
That's a sobering thought. But what if owners do address it? What's the outlook then? Is it hopeful?
Generally, yes. The prognosis is pretty good if the underlying cause is correctly identified and, really importantly, if the owner is consistent and committed to the behavior plan.
Are there stats on how well neutering works, for example?
Yes. Some studies show neutering reduces or stops house marking in a good percentage of male dogs, maybe 50–60%, shows significant improvement or complete cessation.
Yeah.
Interestingly, it seems less effective on outdoor marking.
And for mounting?
Neutering reduces mounting in most male dogs, too. Maybe around 60–70%, though it might not eliminate it completely. It tends to be more effective at stopping mounting directed towards humans compared to mounting other dogs.
That's actually quite encouraging. So wrapping up, it really sounds like the core message is understand the why. That's the key to dealing with marking, roaming, and mounting effectively.
Precisely. It's vital owners grasp that these are often normal behaviors with complex motivations. It's not usually about the dog being bad or deliberately disobedient.
So, for everyone listening, if your dog shows these behaviors, try to observe really closely. When does it happen? Where? What's going on around them? Consider all the factors we've talked about.
Observation is powerful.
And on that note, here's something to think about. What subtle cues, maybe in your dog's environment, maybe in your interactions, might you be missing? What small detail could unlock the reason behind these behaviors in your particular dog? Often the answers are hidden in plain sight if we just learn how to look.